The appointment itself. When you have completed all the previous instructions, you will be redirected to the interview screen, showing yourself and the SP screen. Always allow the sharing of your camera and microphone when requested. You may need to wait for the SP to log in. If they do not log in within 15 minutes, then you will be informed that the appointment is cancelled. As soon as both yourself and the SP have logged in, the interaction begins, as well as the video recording. Start with an informal introduction. The SP may introduce themselves by their real name, in addition to telling you the name of their patient character. And then when you're both ready, you click Start Formal Interview to move into the appointment and begin the assessed component. When the appointment has started, the screen will expand to full size, and at this point you would address the SP as their character. Just like in a normal face-to-face interview, the SP may at times look down at their scenario as they speak to you, and don't be concerned by this. If you experience any technical or network difficulties, please wait first and then try to refresh the screen. You will not lose the interview by doing this. When the connection is fixed, you can click on the full screen button to return to a full image of the SP. Try to keep the allocated interview time. It can finish earlier, but should not go significantly beyond this. There is a timer at the top of both the student and the SP screen, so you can both see how far along you are. Try to plan to wrap up the interview appropriately within the time frame. The SP will also be aware of this, and if you do not end the interview, the SP will likely point this out and encourage the interview to end themselves. When you finish the interview, click the Finish Interview button, and that's the interview done. Now it's time for reflection. Reflection and learning. Following the interview, you will need to complete a number of forms by typing answers into the boxes on screen. There will be various questions regarding both your learning and your user experience. The first is a personal reflection on your experience of the interview in regards to your nonverbal communication skills. Then you will do a self-assessment using the communication assessment form. We ask you for feedback on the content, the scenario, and the SP, and then on the system. But this is not about how you did in the interview. The final component will be reviewing the assessment form completed by the SP. If the SP has not finished, the screen will let you know to wait, and then you just need to refresh the page after a few minutes. Once done, you can review the results as a read-only document. When you click Submit, you will be asked to reflect on the feedback and consider how you might improve your communication skills in the future. Once you have submitted all of these reflection forms, you have completed your EQ clinic appointment. However, there is further learning available to you. By coming back to the system after 48 hours, you will be able to do a number of things. Log in and click on My Consultations. You will see a list of your previous consultations and can review the following. Each will appear in a new window. The SP Comments button will allow you to review the video and see the time-stamped comments the SP made and where in the video they occurred. By clicking on a comment and then pressing play, you can see what behaviour was being referred to. The Assessment Results button will show you the assessment form from the SP and the reflection and plan you gave in response. The Behaviours button will provide a non-verbal behaviour communication skills analysis of your video, a series of visual and numerical representations of your communication behaviours over the course of the interview. There are a number of non-verbal communication behaviours that are being described and shown to you in different forms. Please review these different behaviours to increase your understanding of how not only your words but also your actions can have an effect on the interview. You can use all this feedback to better understand your skills and limitations and work on the things you need to improve to achieve effective clinical communication with your patients. You can see your individual behaviours and compare how different behaviours relate to each other. At the end of reviewing all the content, click on the Final Survey button. This will ask you some questions regarding your learning experience. And then you're done.